My name's Marissa Andrade. I work for the University of Edinburgh in the School of Health and Social Science. And I've been doing, over the last few years, a series of research projects for the NHS, Greater Glasgow and Clyde, about perceptions of health working with diverse communities, minority ethnic groups, lots of different groups, including the Pakistani, Polish, Slovakian Roma, Romanian Roma. And today, and the last couple of days, we've been putting together a really innovative event using a technique called Theatre of the Oppressed to try and share and exchange knowledge that we've learned throughout the research project with other people of the community. So we've turned them into actors.
The idea from this is it's really using theatre as a way to enable dialogue to happen. So it's using theatre as an educational process in which everybody can have their input and we can build some knowledge together.
The perception was that people from the Roma community wouldn't arrive, and they wouldn't arrive on time, and they wouldn't be engaged, and they wouldn't want to be doing theatre or anything like this. And everyone arrived and everyone has been engaged.
If we have the attitude of just getting involved and think, oh well, let's see what happens. Yeah, thank you very much. This is what I like to say. Take it! So it presumes at its heart that anyone can do theatre, that theatre can happen anywhere, and that actually it's quite a right to be able to do theatre, to be able to explore and look at things differently.
What goes here?
Wednesday was about trying to pull together an embodied, if you like, physical demonstration of what these research findings were all about. Why can't people access health services? What do they think about GPs, doctors, stop smoking services, various perceptions of health.
Very good!
And we worked to create these scenes using images in our bodies and to perform and put forward barriers to accessing healthcare before they even get into the door. What are some of the barriers that they're facing? Some people don't even have national insurance numbers. Trying to communicate big issues, huge mistrust and stigma came up over and over again in my research. How do we start building trust and breaking down those barriers? So we've achieved these scenes that we've created and put across.
So let's now do the thing when I tap you on the shoulder, you say one line what you're thinking right now.
I've been waiting for 3 hours, I can't do this anymore.
3 hours, been waiting for 3 hours.
We're waiting and nobody's talking to us to even tell us anything.
Waiting and nobody's talking to us to tell us anything. And finally, listen.
I'm hungry.
Hungry. Good, well done! Thank you! Then we started to explore and create little images and scenes of mistrust between a member of the community and someone from the medical profession. And then we looked at, well, if I could give you 3 wishes to help improve that scene, to improve that image, what would that look like? So it isn't just about identifying problems, it's also about thinking about solutions and not telling people what the solutions should be, but involving people in being able to identify and come up with their own solutions. Image freeze. Freeze. Audience, what changes have they made? What changes have they made? What changes?
Smiling.
Smiling? Smiling, okay. What?
Trust, because they are smiling, so they're all happy to
So smiling helps with trust. Eye contact. You wanted to say something?
Okay, she's giving the paper to him and she's saying...
Okay, giving and taking.
Eu din partea mea zic că văd fața lor foarte mulțumit și doamna și domnul.
He sees everyone with a happier face that's appreciative of better situation.
Okay.
And today's really been performing and NHS practitioners and different people stepping in to their reality and having a dialogue. It's all about having this conversation.
May I have your national insurance number, please? Okay, everything seems okay here. Of course, yeah, that's good. Yeah, that's good. Everything seems to be in order here. Yeah, everything's good. I'm sorry, I've not got my national insurance yet. I've applied for one. I'm sorry, without a national insurance number, I can't help you. Please leave.
Okay, good, thank you.
And the idea is for them to then step in to the action and become the actors themselves. So they become spectators. And it's all about really breaking down barriers and perceptions and building trust and sharing information and learning from each other.
Dear, take a seat. Yeah. Your head forward. And your foot. Can you speak English? Yes. A little. You need an interpreter. The same things happened to me.
I think we're at a really exciting time in Scotland, particularly in areas like the south side of Glasgow, where we have diverse populations. So we have lots of different minority ethnic groups living in a relatively small area. But what we have as well is just a rich tapestry of people who do care and do want to engage.
So
I come here today and Wednesday for this project, which is talking about realities of living here, about our lives. I didn't expect to see people as genuinely wanting change or looking to make some changes, but Wednesday and today I've come across some very nice, extraordinary people. These people are very interested in our lives in Glasgow and the fact that we don't speak English. We'd like to thank everyone for offering us this opportunity so that we can present certain barriers and hopefully a chance to overcome these barriers.
The asset-based way of working, co-production, we always ban these terms about as if they're just tokenistic. Well, actually, when you go and work with people and hear what they have to say, and instead of telling people what to do, actually hear how they would like services to work with them rather than being dictated to, you really do have a real starting point for change. And I'm really encouraged that by using these positive psychology approaches, identifying people in communities who want to do things to change and make things better for themselves and people around them, and to just start being a bit more human and caring and kind and compassionate, I think we really have a chance here to shape the way policy works, to shape the way health works, and to make things better for all of us.